exposures. I'm anxious all the time. I'm always worried about my health. Why would I want to do an exposure and make myself even more worried? We go through exposures because a lot of times we spend a lot of time running from anxiety, and now we try to face anxiety to give us more power. We're going to talk today about why exposures or challenges and the difference between them can be so important with health anxiety. A lot of times what people think is they think of exposures as what we would actually call exposed moments. Now, an exposed moment is any time we're going about our day and we run into a trigger that makes us feel anxious. You didn't choose that trigger. The world chose it for you. So a lot of times we can still use our skills, all of our ritual prevention skills in those moments, but truly those are the times when the world has chosen for you to be anxious instead of you choosing it. An exposure is a time where you intentionally do something to be able to become anxious. Now here's why. You might be wondering, but I'm anxious all the time. I'm always worried about my health. Why would I want to do an exposure and make myself even more worried? And one of the reasons we do exposures is because it is a way that we get to take power and control over the health anxiety. No longer is the health anxiety choosing to do something to us. We are actually challenging it ourselves. Now, there's two ways you can think about exposures. There's either things that you could go do that maybe you're avoiding, or there's other things just like thinking a certain word or saying a certain word that may make us feel anxious. Now, in those moments, we don't need to feel anxious if we hear a word. A word is not dangerous for us. However, even though a word is not dangerous, our body reacts with anxiety. Now, there's a lot of different exposure ideas that could be out there. And that is anywhere from just saying a triggering word, saying a statement that may be triggering, going to a hospital or a doctor's appointment. All of those are exposures because it's something that we're doing that would bring on some level of anxiety. So what you can do is start to think about what are some of the things that maybe you interact with that makes you feel anxious. For the sake of this video, let's just say it is writing down a word, such as cancer. Now, writing is a word of cancer on a note card, on a notepad, whatever that may be, is not a dangerous thing to do. Just because you write it down doesn't mean that you have cancer. However, your brain takes exception to that because it hears that word, it sees it, and it starts to become anxious. That is the false alarm of health anxiety. And by avoiding that false alarm, we strengthen it. That's why we do an exposure, so that way we can challenge it and also teach our brain safety that a word can be a word. So what I want you to do is I just want you to take a second to think about if there's something in particular that maybe would make you feel anxious, maybe would make you start to, to have a tendency to ruminate. Okay, take a second here. And while we do that, there's an important part of preparing for an exposure that I want to start to go through with you. If you did an exposure like this, what do you think would start to happen? So that's the first question that we have to sort out. The second question is, when you feel anxious about this word being written out, what would you be tempted to do? Would you be tempted to get rid of it, throw it away? Would you be tempted to start to ruminate in your mind about if this was the case or not? Would you also be tempted to maybe pay attention to your body to see if there's any sensations? These are rituals. And our goal with rituals is to practice an exposure without performing rituals. That's why we call that ritual prevention. So that's your second question that you're going to start to write out, which is, what might my brain be tempted? What would it want me to do if I was faced with this anxiety? Okay, number 3, we're going to start to create a game plan about if I do notice that I want to do a ritual, what could I do instead? We have to start to create some guidelines about if I do feel like my brain wants me to pay attention to my body during this, what else could I do at that moment in time that would be more helpful? So the 3 questions again: what do we expect that's going to happen? Second, what ritual or compulsion might our brain want us to do? And then thirdly, what are we going to do instead? We go through exposures because a lot of times we spend a lot of time running from anxiety, which gives it more power. And now we try to face anxiety to give us more power. We start by trying to brainstorm either things we avoid or even things like a word or a phrase we could write out that maybe would make us feel anxious. Once we have that thing, we start to think about the questions beforehand, which is, what do we expect this is going to be like? What rituals our brain going to want us to do? And what could we do instead? We practice the exposure, we ride that wave of emotion, and then we follow it up with the very end, which is starting to go through what was important about doing this. Was the outcome the same as what your brain expected? And then finally, what do we learn from this that we can use for future situations and challenges? And when you do that, congrats! You've done an exposure and you are one step closer to beating health anxiety and living with fear instead of in fear. Until next time.